So, Dr. Rao, cryoablation, you have a male or female and you cryoablate a tumor. Do you still remove it or?
No, so what I do is I identify, the patient comes in, we identify this lesion under ultrasound so I can see how big it is. If it is of a reasonable size, I can't do a super huge mass, but if it's most of these are under, 2 centimeters or so in size, I identify it. I numb up the skin over there, just putting a little bit of lidocaine. So that numbs up that whole area. Then you put in a tiny little probe just through the skin surface. You park that probe right within the mass. And this probe is a special probe. It actually starts freezing, okay? And it freezes and creates an ice ball. So this ice ball basically destroys that tumor tissue, okay? It causes it to die. And so that tissue will just slowly over time, it's dead tissue like anywhere else in your body, it will start to break down over time. I don't have to go in and physically remove it. It'll just become almost like scar tissue. It can become blood products, but it'll slowly over time shrink and just basically resorb and become part of the natural architecture of your breast. So nobody needs to go in and do a big surgery. Nobody's gonna have to come in and surgically take it out. And that's the benefit of this. So this is one of the things that, especially these patients, it's for eligible patients, even patients, as young as 60 years old, whose cancers could even be more aggressive potentially. They have said we can easily do this, and there's really good data that we're seeing on patients doing well without having too much recurrence and too much spreading of the breast cancer.